I'm Dr. Tom Larkin, and welcome to the newly rebranded podcast called Smoking Gums. Now, I'm going to tell the story as to why that change has taken place. It has to do with technology, biology, and the purpose-driven people who are really making a big impact in proactive healthcare. I'm going to introduce you to somebody who is doing just that, and I'm going to bring onto the stage Dr. Joseph Denning from Burnt Hills, New York, but actually Saratoga Springs, one of my favorite places. Hi, Joseph.
How you doing, Tom?
So how far are you from? You're right outside of Saratoga?
I live in Saratoga. I practice in a small town called Burnt Hills. It's about 20 minutes or Saratoga.
About 20 minutes? Okay, awesome. And I didn't make it up this summer. I apologize. I promise to do that next summer. Okay.
Well, I'll hold you to it. You have to show me how to bet on the ponies because I've been living there for years, and I still get intimidated when I go up to the
No. Well, you're going to have to come to my April meeting because this past April, you were here 2 meetings ago. I kind of incorporated the horse races into my meeting, and I had Dr. Bale Doneen Method came to speak, and he's a big horse. He's actually coming next week. So our races are 3 weeks, so it's very condensed.
Oh, wow.
3 weeks in April, 3 weeks in October. And so we had so much fun. So all of my speakers went to the races the day before my meeting. I said, I got to include that for everybody, because it was so much fun. So that's going to be a part of that going forward. So anyway, so what I want to do is I want to catch up with you. I know you're doing some really important things. Tell me a little bit, how long have you been in practice? Tell me a little bit about your practice.
So I own the practice with my wife, Dr. Laura Johnstone. And so we graduated Stony Brook Dental School of Dental Medicine in 2011. And then we kind of bounced around a while. We had some good associateships. I had some really great mentors. And then we opened our practice in 2019, 1 year before the pandemic.
Wow.
And so I remember I was having a phone conversation with my mom 1 year to the day we opened, going, what, Mom, I think we're going to be all right. We're getting patients. I think we're going to be okay. And then the pandemic hit, right? Wow. And so it was it was a dynamic time. But they say, what doesn't kill you makes you stronger, and I think we're stronger because of it.
I did not know that. You are a warrior, man. The timing of that. That was just a super, super odd time. So what has drawn you toward this concept of the preventive model, and what interested you in phase contrast microscopy? Because I have a lot of people, make inquiries. Surprisingly, a huge number of people have never heard of it. And I thought, well, if I just kind of walk through with you and just what your experience, why did that make sense to you? Okay, when you first saw it.
So I was really fortunate because my wife and I, we attended Stony Brook, and so they have an oral medicine program. It's pretty unique. We had a lot of early on experiences with PhDs, with research dentists, dentists that weren't doing clinical stuff. And so we learned a lot about the oral systemic connection from the beginning, right? And so the perio program was really strong there. And so we knew all of this stuff. But it was intellectual. It was never applied to daily practice, right? And so I knew I could be doing more for my patients. I knew that, I was responding to disease. I was being reactive to problems, right? And so I didn't want to just spend the rest of my life finding holes and drilling them and referring disease out, right? I wanted to be preventative, and I know my patients wanted to be healthy. It's just I never saw something that connected what we had learned and what we have known really for 50 years, right, to actual clinical practice. What are we doing on Monday morning in a dental office?
Okay,
I knew. And then I heard about you, and I thought this is somebody that's making that connection into the real world. So
I knew there was a
pilgrimage out to see you. Yeah,
I can usually see it from a distance, kind of a light bulb moment, like, oh, this makes sense, and it really had a lot to do with your educational, that makes total sense now, because I can't tell you how many people this is very puzzling to them. It's like, microscope, what's that about? They just can't connect it. So it was a natural progression for you then. So in your practice, talk to me about patient intake. Like, do your patients see the hygienist, or do they see the dentist first, as far as like intake?
I would say it really depends. So one of my practice kind of quote unquote rules for my team is if someone's in pain, I want to see them, right? And I really want to see them on the day they call, right? So for some of my patients that are, they have acute problems, I'm seeing them that first day. I'm doing a limited exam. Also because the other end of my practice is I focus on people with phobia, right? And I do some sedation. I do a lot of laughing gas treatment, right? And so a lot of people are finding me for, because they've had bad experiences and they're looking for a place to feel safe, right? So I see a fair amount of new patients on an emergency where they've been putting stuff off for 20 years. Yeah. They're really sick. And so I'm not going to make them wait for a full exam. I'll see them for that limited if they're in pain, right? But if they don't have any acute pain, they meet the hygienist first, and we do a oral comprehensive exam first.
Okay, so how do they introduce the concept of biofilm? Because it's a different conversation, right? We're not having that conversation not so much about pockets and bone loss. This is more proactive. It's like an awareness program. How do they do that as far as like in their protocol?
Well, interestingly enough, my undergraduate background, I did all the prereqs for, dental school, but I was an English major, right? And I love literature. And so I try and frame things like a story for the patients, right? And so for my hygiene team, I have them tell the story of what's going on, and the microscope's just a natural progression of that story, right? And so we'll meet them, we'll take their medical history, right? We'll learn about, their family dental history. We'll learn about their family medical history, their own medical history, and we'll start asking about, questions they never had, before about systemic illness. So we do that. And then we take x-rays, of course. We do full comprehensive, intraoral x-rays and a panoramic, because I've just been shocked how much stuff can be missed, right? And so you don't see it if you don't look. And so we make sure we're not missing any disease that's in the mouth. And then I just have a ton of intraoral photos, right? When they're doing their periodontal charting, they're taking intraoral photos, and there'll be that bleeding on probing, that indicator of inflammation we've seen forever. And so I have them take photos of that bleeding, right? And one important thing is I want to make sure that the hygienists aren't poking them too hard, and that's why they're bleeding. And so I'll ask the patient, am I hurting you, right? And they'll say, no, you're not hurting me, but oh, look, it's bleeding, and we're taking that photo, right? And so the patient's understanding gradually, the way we understand as clinicians, there is an issue, right? There is a problem, right? Then we take the slide and we show them, the bacteria on the screen. And so what I'm doing is I'm going from that known experience for both us and the hygienist, that known experience of we've always forever looked at x-rays for bone loss on the x-rays. We've always forever we've measured with a stick for bone, pocketing on there. We've always looked for bleeding on probing. Now this is just another indicator for us that there is disease, right? But what fascinates me and what I think is brilliant about what you did, bringing this kind of to the world and make a focus on this, is we actually have some evidence that what we're doing is working. Yeah. Right? Because we're going to do whatever therapy we're going to do. We're going to do whatever home care we're going to do. But we just kind of said, okay, we did a scaling and root planing. We did a deep cleaning. So what? Is that patient healthy? Now we can have them back on a follow-up. We can take a new slide. We can actually see, did we affect the change in this biofilm? And so for the first time ever, I think we really have an evidence-based approach to getting our patients healthy. And nowadays, with everybody having a video studio in their pocket, in their phone, I have them take videos of their slides, right? And so now when we take the follow-up slide, they can compare and contrast, right? So the patients are getting it because seeing is believing, and really, it's amazing how many, what you find when you actually look.
You've jumped ahead, and 3 of my questions you've already answered. First, I want to thank you for taking pictures. I really encourage that, and that's more of a hurdle for people than I thought. Because I think taking intraoral photographs are just it's all the visual part, right? It's the communication with the patient and an experience that they've never had before. And then quantifying, on subsequent visits, is your slide less active, more active? And then the patient, what happens with the patients, and this, they kind of get engaged in this. They look forward to seeing their slide. They know that they're being monitored. They get pretty smart from the standpoint of, I always talk about cheating before you go to the dentist. Like, somebody will like brush and floss the week before they go to the dentist for their recare appointment. Well, you can't do that with a microscope. That's not going to work. You know, you have to be diligent about it, you know, to keep that biofilm shifted. So, wow. Now that what a great testimonial. So when you first did this, and once again, I'm thinking about these people that are kind of, this is new to them and they're going to be looking at this podcast. What are the challenges like initially? Okay, you set up the microscope and, you know, I teach how to take the sample and how to read it. What kind of challenges in the workflow? Because I think they're minimal, you know, from the standpoint of it's really not a huge time consuming thing once you learn how to take the sample and you put it up there, it's there, right?
So I'm going to answer your question like at several levels, if you don't mind, right?
Yeah.
Because I think a lot about this. So I think there's a philosophical issue, right? Because we're trained, and again, I'm not putting any particular school down, but the reality is we're still barber surgeons, you know,
right.
We're trained in the reactive model, right? And so the biggest thing to wrap our heads around is, you know, we're qualified, right, to have these conversations about their overall health, and no one else is having this conversation with the patient. You know, by and large, they're going to their primary care provider, and you know, maybe they're getting a prescription 3 seconds after meeting them, and there's no conversation about their diet. There's no conversation about their risk. There's no conversation about, you know, how to prevent disease. We're just reacting to it, right? And so that workflow you talked about, you got to get away from the 3-second check, you know, picking teeth for decay, right? And just sit down with your patient and just understand their risk with them. And your role, you know, is multifaceted, but it's mostly educational. How can I empower you to get healthy, right? And the thing that I was insecure about is, do my patients really want to hear this from me? I'm just their dentist, right? But, you know, there's a quote that I love, which is, you know, opportunity lies where responsibility has been advocated, right? And unfortunately, no one is taking responsibility proactively in our culture, health-wise, right? And so there's a real opportunity as a dentist. You have more time with your patients than really any other medical professional they're going to see if they come twice a year, right? So our ability to affect change is really powerful and really there. And I will tell you, the patients are hungry for this conversation. They've been great. They're never looking at you like, doctor, you know, why are you saying this? They're just happy someone cares, and they're happy to talk to somebody that can give them useful information, because people want to be healthy. They don't want to be drilled on. They don't want to be, you know, periodontist. Look, I love periodontists. I've got a great periodontist, but who wants surgery? You know, I don't want surgery for myself, right? So they're super thrilled to finally have some preventative, proactive tools, right? And so that mindset of what's my role in the overall medical system, to me, that was a big hurdle because I was insecure about it, right? But patients want to hear from us in that level.
They do, and I've never been more convicted of that than in the past 6 months, in that my job is really not to educate the public, it's to educate dentists, okay? Because I think the public, because our healthcare system is so broken, and they're on Dr. Google, they're looking for solutions. They're getting their labs drawn. You can get labs now without prescriptions. They're doing all these, you know, influencer, you know, health guys, you know, there's a whole slew of them paying a lot of money. And this is just a part of it. So when they go to a reactive dentist, that dentist is not fulfilling their overall vision of what they want. They know what they want. And I think the number one thing that people want is to be listened to, you know, in their healthcare visits, to have the time. So once again, you keep talking about time, you know, God bless you. You're taking the time, but it's yielding results by taking the time. Yeah, no, that's awesome. So one of the other questions I had is that, does the visual evidence of taking the slide increase compliance with your home care recommendations?
I'll get a little personal with you. I'm a dentist. You know that. I'm married to a dentist. Half my friends are dentists, right? When I took my own slide, it wasn't great, right? And so just from a personal standpoint of, yeah, you know, I wasn't lawyer picking before. Now you betcha that I am, right? It's just, I think there's something about human psychology, right? We're not, you know, we respond to what we see, right? And if we don't see it, it's not there, right? And then once you see that on the screen, right, it's crystal clear that your body's being invaded, You know, it's amazing. You watch these critters, and there seems to be like some intelligence behind some of them. They're attacking white blood cells, you know, and so you're like, oh, this is a war, and now I need to get in the game and up my game. So yeah, from a compliance standpoint, I don't think there's anything better for patients to really understand. But you know, I mean, I've been a dentist for over a decade, and this is my whole world, and I would get a cleaning, and you know, my own staff would say, hey, you got a little bleeding, you know, on the lower left. And I would think, okay, I've got a little bleeding. Who cares? Now you see what's happening, and you really can take it seriously.
Right. No, that's awesome. So I forgot to mention the story. I got to tell the story why I renamed the podcast. So on this call last week, and it was awesome. And you're going to meet this Dr. Larry Page, DDS, PhD, periodontist microbiologist. He's 84. And he's new to my world. And he worked with Dr. Kais and Dr. Ramsey Temple using a microscope for 50 years. I mean, he's just been, and he just reached out to me a couple months ago to thank me for doing this, because he said, he goes, you see, we didn't have a lot of success. And he's talking about, you know, 20, 30 years ago, trying to introduce this. And he's the only person that has a direct connection with Dr. Kais that I know that's still around. And so anyway, so we're on this call, and Dr. Bax, I think you met Dr. Bax when you came to Lexington. He does a carotid ultrasound. He's kind of my preventive guy. So he was talking about a patient who had their medical labs, and their medical labs were a little bit out of whack, some of the inflammatory biomarkers. So he had the patient take a salivary test, got the salivary test back, and all of the pathogens were like, you know, maximum, high, whatever. And he goes, that was the smoking gums. And I wasn't sure what I heard. I said, excuse me, did you say smoking gums? And he goes, yeah. I go, oh, shit, that's brilliant. You know, so I registered the domain name. I said, you know, because so a smoking gun in law means, you know, that's irrefutable evidence. You know, if you got a smoking gun and a crime's been committed. And then if you have bleeding gums, that's irrefutable evidence that we got a problem. And now it's smoking gums. So I'm gonna run with that, because I think it has so much. But anyway, so that's the story behind why I wanted to make the shift, because this whole concept of we just have not progressed in the treatment of periodontal disease, you know, to speak of. Over decades, and we have to make some inroads in this. And like everybody most of the people that are doing this successfully, this is a really, it's a fairly straightforward approach. There's not a lot of ongoing cost other than your slides and cover slips. And then for those patients that are medically compromised, if you want to take, you know, the next step and do salivary testing and identify the pathogens if they have diabetes or this, that, and the other, that's always an option, but they're more receptive because they understand the conversation. Because when salivary diagnostics first came out 10 or 15 years ago, I knew that they would not be very well accepted, because number one, they're not covered by insurance. They're $150, $200 out of pocket. But I knew that would be really hard to explain, right? But once they see the bacteria, and then you have conversations around the bacteria, the chances of that patient doing that are much greater, you know, because it's a logical, you know, it's just, I love what you said about storytelling, you know, and kind of weaving that into a story. So that's awesome. So if a dentist is just generally skeptical about the microscope, and once again, on many levels, you know, one of the things that I've been able to do with the training is to train virtually. I had to get a standardized microscope so that we're all speaking the same language. I can't support, you know, a multitude of microscopes. And then my training it's virtual, it's online. I mean, I have an annual meeting to kind of discuss all of the things that are around that. But if a dentist is skeptical, what is one insight? What's a word of encouragement that you would tell them?
I don't know if you'll like this answer, Tom. I think this is something you probably should be searching for to do.
Okay.
Right? Because this is a hard shift to make. Hard in the sense that I think you need the passion,
yes,
right, to go there every day and lead the team and affect this change, right? And if you need convincing, I think there's plenty clinics and mills, and I'm not degrading what anyone else is doing, but there's plenty of people doing the regular thing. So I think and again, I'm not just blowing smoke, Tom. I think you're a bit of a prophet, and I think people that need to find you are going to find you, and then we'll lead this kind of charge together. I hope that's not too high-minded, but I think that's the truth.
Yeah. Well, that's 100% how it's happened. 100%. It's always people showing up on my calendar, even like Dr. Page, he was out Googling microscopes, and, I'm somewhere in the mix there. And you define exactly how this has gone down. It's someone that, they feel it. Well, it's my very first consulting client when I wrote my manual. This is before I was even training with the microscope. I put a manual on prevention online, and someone bought it, and I was like, oh, this internet thing's kind of cool, right? And so we set up a call, and I start to talk to the guy, and he's an older guy. I could tell he was older. And the first thing out of his mouth was, Tom, this is the dentist I always wanted to be. Okay. And I was like, okay. So he's self-identified as someone who was looking for a path, but he already had the passion. His advocacy in dentistry was helping people and I get it. That was a perfect answer. That was an absolute perfect answer. Yeah. Well, I tell you what, you have absolutely covered everything that I've, half of my questions you answered preemptively, because you've had a beautiful experience, and you've done just an outstanding. You're exemplary. I mean, I didn't know exactly how this was the podcast was going to go, but I would just say this is what it needs to look like. And I thank you for that.
Can I add one question you didn't? Can I ask one question you didn't ask?
Yeah.
Which is, how did your hygienists, how did the rest of the team respond to all of this? Right. That's a question you didn't ask, which I think, how do I want to say this? I think there's a problem in dentistry, and I see it. And there's been some troubling things you see online in some groups, between each other. Some people saying nasty things are being said, right, on kind of both sides, right? Yeah. And I think especially after COVID, a lot that kind of raised the bar for people that were already dissatisfied with the profession of hygiene. They started exiting en masse, right? And it was just an impetus for that to happen. But really, there were underlying symptoms there, right? Yeah. And so, to me, it's just been incredible to just watch my team blossom into the clinicians that they always were, right? And one of my hygienists kind of broke my heart a little bit, right? Because I came back from your meeting all fired up, right? We just ordered the microscope. It was coming in the mail, and I was talking to him about all these connections and all this kind of stuff, and the connection between oral systemic and all that. And he goes, Doc, I've been talking about this for years. Just nobody cared. Right. And it's like, we as dentists, in a lot of ways, where we're holding the hygiene, we're holding our colleagues back. Right. And this is a way to kind of fully utilize their training, fully utilize their capability. Right. And you want to see a fired up hygiene team, something like this, where you can elevate people and you're doing better. You're doing, better care for folks. It's been marvelous.
Well, that's the leadership moment, right? You provided the leadership to say, okay, let's do this. And they were kind of smoldering and ready to go. And gosh, you've just have explained my world so incredibly well in that, that whole alignment, because sometimes a dentist will reach out to me and I'll say, listen, I'm totally happy to jump on a Zoom call with your hygiene team. I said, I don't want you. For this thing to work, there has to be alignment, okay? And there are people, I've seen hygienists say, not interested. I am not interested. So and it takes time to get all that alignment. I mean, I've watched it in some of the practices that I've helped here. But when you get it, it's magical. I mean, I experienced it personally in my private practice. You're obviously in a sweet spot, and I see all the things that you see on social, because I kind of cruise around to different things, and it's really distressing. Dentistry is in a very convoluted moment right? And hygiene it's right in the middle of it, because it's a third of your business, right? And this whole concept of, what do we do with that? And once again, it's not going faster, it's going slower, it's having conversations. The path is there, the roadmap is there, but it's just getting through the noise. There's a lot of noise right now, for sure. Yeah. All right. Any more words of wisdom, Joseph? You're amazing. I know you were good, but you've really you've over delivered, for sure.
Well, honestly, it's from you. That's high praise. I want to thank you for that meeting. It really was life-changing, and I appreciate you and what you're doing. Seriously.
Yeah. Thank you for this. This is a good kickoff for the Smoking Gums podcast. All right.